Good morning, and thank you for joining us for our 2021 COVID-19 pandemic update. My name is Don Walker, and I'm Communications Director for Brevard County Government. And we have a panel of folks here today that will provide you recaps for 2021, as well as updates on where we currently stand as far as COVID-19 cases in Brevard County. And we'll take a look ahead toward the future as we head into 2022 on what types of expectations our health officials have in terms of what we might see either in new cases or the Omicron variant or whatever else might be out there for us. I'm joined on the panel today, as always, with Maria Stahl, who is the administrator for the Florida Department of Health Brevard, and with her is John Davis, who is Community Health Nursing Director for FDOH Brevard. We also have John Scott, who is the Emergency Management Director, Matt Wallace, our Public Safety Director, Ian Golden, who is the Director of Housing and Human Services, and we also have Jesse Ray, our Social Media Specialist, who will be monitoring our Facebook Live event today for any questions that may be posed to us by the audience, and we will do our best to respond to all of those questions before the conclusion of our program today. So as I said, I'm hoping today we can provide some type of recap of the year, an update of where we stand currently, and look ahead at what we might expect in the weeks ahead, whether it's another anticipated surge in positive cases, the Omicron variant impact, or ongoing efforts to mitigate the virus's impact through the continuation of vaccination programs, testing, and monoclonal treatment. I did issue a press release earlier today concerning our testing sites, which are held in coordination with FDOH Brevard and also Parish Hospital in Titusville. There are 4 testing sites, and all have closings planned during the holidays. So you can find that information not only on your screen currently, but also on our Facebook and Twitter pages for both Brevard County Government and Brevard County Emergency Management. So at this point in time, as we usually do, we will turn it over to our folks at FDOH Brevard for an update from our health officials. John?
Yes, so just wanted to start with giving an update from when we last talked here, which was late October, I believe. And so over November, we saw a steady decline in cases. We actually went from a community of substantial transmission to one of moderate transmission, meaning we were below 50 cases per 100,000. The third week of November, right before Thanksgiving, we were at our lowest point in case rates with 37 per 100,000. After Thanksgiving, we have seen a slow rise in daily cases. Last week, we were back to 50 per 100,000. So I'm anticipating we'll be right around that mark this week when the numbers come out a little later today. So again, that puts us back to a community of substantial transmission. So the recommendations in that category are that folks mask in public indoor spaces. Again, we urge vaccination for those that haven't been vaccinated. If you are fully vaccinated, we urge you to get the booster dose. I'll go over that a little bit later with who's eligible for that, and continue to use those mitigation measures we know work: vaccination, masking in public crowded indoor spots, and of course, hand sanitizing. So hospital-wise, our hospitals were experiencing a low census of positive COVID throughout November, and had actually gone to levels that we last saw in the spring of 2020. Over the last few days, there have been a slight increase of positive COVID patients in the hospital. In terms of our daily cases, we are starting to see a rise. We've essentially doubled from the beginning of the week to the end of this week. Schools, after the nightmare of schools starting in August, right when we were at our peak with the Delta variant, the school cases have dropped dramatically and continue to be very minimal. Our long-term care facilities are looking good, just kind of ones and twosies here and there. Deaths, likewise, those rates had dropped steadily from our peak in August. And so there's many days where we're in the single digits, some days no deaths reported on those dates at all. Vaccination coverage for our county population, essentially that's at a standstill, unfortunately. Right now with our 5 to 11-year-olds, we're at about 11% of that population that's received at least one dose of the vaccine. Our 12 to 19-year-olds are at 49% coverage at this point. The good news is that over 110,000 residents have received their booster dose at this point. And that's mainly what we're seeing in the adult population is the folks that we're essentially getting on a day-to-day basis are there for their boosters. We're not seeing a lot of new vaccinations, folks starting up their vaccine. So again, I want to remind everybody that it's the biggest tool we have in our toolbox. Please, if you haven't been vaccinated, come out and get your vaccine. The CDC now recommends that anybody 18 and over should be getting their booster shot. Those 16 and 17 can get a booster. Again, as a reminder, if you've had Moderna or Pfizer, your booster dose can be given 6 months after the completion of your initial series. So 6 months after you've completed your first two, you can come on in and get the booster. If you've had J&J, that would be 2 months after your first J&J injection, you can come in and get a booster. Our Vieira facilities are open Monday through Friday, and shots are given 8 to 4. We are testing there as well. So if you need testing, you can come in Monday through Friday, 8 to 6. Our Melbourne facility is giving vaccinations out Fridays 1:30 to 4, and our Titusville location is doing that as well, Fridays 1:30 to 4. Again, I also want to emphasize we are giving the flu vaccine. I would encourage folks to get vaccinated against the flu. That's a yearly vaccination, and we are starting to see cases in the community. So again, I would urge you to get vaccinated against the flu. Looking at where we're at now, again, we're a community of substantial transmission at this point. Our vaccination rates are basically at a standstill. Deaths have declined, nursing homes looking okay, hospitalizations are down a bit, but again, they're starting to see a little increase. We're starting to see a little increase in our daily case rates. If you look at the numbers from the South Florida counties, they're seeing a pretty dramatic increase in their daily cases. As you are aware, the Omicron variant is in the United States. It is in Florida. We haven't had a report of any of our specimens taken in Brevard County coming back with Omicron yet. I expect that any day now. You may have seen in the media reports from Orange County, the testing of the wastewater is showing Omicron. So it is here. What will be the impact on the community? That's hard to say. You've seen reports of colleges being shut down in the Northeast. The reports are that most folks that have it there have had mild illness or no symptoms, but of course you're looking at a younger population that's essentially fully vaccinated. So when that gets out to the general community, where you have elderly folks with comorbidities and whatnot, we'll have to see what the impact's going to be. Looking back on the numbers from the beginning of this whole pandemic, through last week, we were at 82,136 cases. And again, these are documented positives. So we do know that our actual cases are exceeding that number, but those are documented positives that we've had. People vaccinated over 387,000 in our community. That puts us at a 66% of our community being vaccinated at this point. And positivity rate, again, right now we've been at a low, I think about 2%. Right now, I believe we're climbing. We're going to be looking at probably a 4% rate going into next week.
All right, thank you, John. And I'm going to throw a curveball at you here because I don't I don't often waver from our programming, but I just wanted to, for clarification purposes, when you say a community of substantial transmission, that kind of has a frightening sound to it. And, you know, when you said we're at our lowest point, we were at roughly 37 per 100,000, and we're currently at roughly 50 per 100,000. How would that compare to our highest point?
Well, our highest point, during the peak, we were looking at, we believe it was 300 per 100,000 we've gotten to at one point. So again, it looks much better, and it's been better over this last month. But again, we have seen an increase over the last 2 weeks. So again, 50 per 100,000 is actually that threshold where you move into a community of substantial transmission. So we're just into it right now.
Okay, thank you, John. And I appreciate that. We'll turn it over now to John Scott, Emergency Management Director, for an update from Emergency Management. John?
Thanks, Don. Again, my name is John Scott. I am the Director for Emergency Management for Brevard County. A couple of things I want to touch on this morning, just sort of build on what John is talking about. I'll start with our monoclonal antibody treatment center that we had at Kiwanis. That site remains, that treatment option remains available, but we have moved it from Kiwanis Park to basically what is the corner of Barton and Fisk and Rockledge, or will be the future home of the Thrifty grocery store there. So we are in that parking lot. We are open 7 days a week there. There's an additional criteria change. If you remember before, it was the criteria was anyone who tested COVID positive or thought they had a close contact exposure and were themselves immunocompromised. However, due to a nationwide shortage when it comes to the monoclonal treatment, they have moved to you must now be COVID positive to get treatment. That's the only change. Any type of test will do. So a rapid test or a PCR test will suffice for verification of your COVID positive status. We want to make sure everyone understands that change is there, as the monoclonal is an important treatment. And we talk about what our options are from a tool in the toolbox standpoint. Two, talk about testing a little bit. As Don mentioned, we did partner with the Department of Health, Parish Medical Center, West Melbourne, now the city of Rockledge, to offer testing at some locations throughout the county. Those are the ones Don mentioned you saw on your screen earlier. I just want to highlight the closure dates. So the health department site, that'll be closed December 23rd, 24th, 25th, 30th, 31st, and 1st. They have always been closed on the weekends, but those are some holiday adjustments. And then the sites at Parish Medical Center, the site in Rockledge, where testing is available next to the monoclonal site, and the site in West Melbourne, which is the Field of Dreams Park, will be closed December 24th, December 25th, December 31st, and the January 1st. So essentially Christmas Eve, Christmas Day, New Year's Eve, New Year's Day. Otherwise, they will be open regular business. I know there's a lot of discussion in the community about Omicron. John did an excellent job talking about what it's looking like now. It's obviously still very early, and what we're going to see from Omicron and what impacts we can expect. But I think it's important to talk about the steps that we can take today as a community in advance of that, right? We know what works when it comes to how we mitigate best against COVID, regardless of the variant. It's good hand washing. It's wearing face coverings. It's social distancing. It's avoiding large crowds when you're indoors. And really, again, a key thing here is if you're not feeling well, stay home. Don't socialize. And we talk about the importance of ending the cycle of transmission. We know with Delta that transmission was, for every one person who was exposed, it could be as many as 8 people who would then get exposed from that one person. And the difference that makes when you begin to talk about, 1 person to 8 people to 16 people, and we grow exponentially from there. What's critical, especially as we go into this holiday season, and we know we want to get together for this holiday season. It's been another rough year for all of us. We really need to be mindful of those things so that if you are going to go to a holiday party or a holiday gathering and you're not feeling well, as tough as that choice may be, you're actually probably doing everyone at that gathering a tremendous, tremendous favor and doing a great job looking out for their health and safety by staying home if you're not sick, or if you are sick, even if you're not sure it's COVID. So those things are important. And I just want to highlight from a mindset, we've done this a while when it comes to COVID. And if this were a hurricane, right, we use that mindset for this. Like if there was a threat on the horizon, we wouldn't wait till the rain starts falling and the wind starts blowing to take those protective measures that we do in storms. We wouldn't wait to board up our house. We wouldn't wait to go get extra supplies. We wouldn't wait until the storm was there. We would start acting as soon as we knew there was a threat on the horizon. And we can do the same thing with COVID and the Omicron variant. We know what's on the horizon. We don't know what the impacts are going to be, but we're going to start getting ready today, right? So we're going to return to being vigilant about those things that are our great COVID protective measures: mask wearing, hand hygiene, social distancing, and staying home when sick. And every single one of us can make an impact as far as what the severity of this Omicron variant is going to be. It can either be a low severity or a high severity, and we have a huge impact on that with the actions we take. So again, I implore everyone to return to vigilance, to really be cognizant of what we're doing. And if you're not feeling well, please stay home. Don?
Thank you, John. I had mentioned earlier that the testing sites and their hours are all located on our social media pages. I should also mention that they are also available on the county website, which is www.brevardfl.gov. Down toward the bottom of that page are the latest information, and you'll find the press releases for anything that's COVID related that we've put out down in that section. Also on our website, we know this has had a tremendous financial toll on some people, and there is assistance that's available for folks, including rental assistance, and you can find the application for that on our website. And I will turn it over to Ian Golden, our Housing and Human Services Director, who will provide you an update on that program and where you can get your application if you need assistance. Ian?
Thanks, Don. Before I do that, though, I would like to just make a couple of comments. We recognize that there are some people who, if they're sick, can't not go to work. Low income, you might not have any leave. So in those instances, you really should be using PPE at work, socially distancing. And then also, I'd like to give a shout out to the health department. I got my booster shot this week, and they were incredible right here over at Viera. It was efficient. It was quick in and out. So thank you. Yes, the emergency rental assistance program, we do still have probably about 50% of the funds remaining. We've seen received about 2,500 applications. Of those, about 67% have been approved. About 32%, 33% have been denied. The rest are in some type of processing. And that means that we're waiting on information from the applicant. There's a lot of back and forth when we get incomplete applications. We're seeing probably about 90% of the applications that are being submitted to us are incomplete, either missing signatures, missing documents, so on and so forth. One of the things that we are doing to try and address that, we're hoping in the first or second month of the new year, we've partnered with the libraries even further. You can drop applications off at every library, but we're also partnered. We've identified 4 of the libraries that receive the most applications and are also in low-income communities, and we're going to be embedding staff at those libraries whose sole purpose is to assist people with submitting complete applications. So that's something, again, that we're working towards in the new year. We've obligated, again, a total of almost $9 million, about a little over $9 million remaining in the program.
All right, thank you, Ian. And speaking of booster shot, I received my Moderna booster shot at Publix, and that also was in and out. So they're available, readily available out there in the community. So again, we highly encourage people to A, get vaccinated, and B, if you've been vaccinated, to get your booster shot. With that, I'll turn it over to Matt Wallace, our Public Safety Director, for an update. Matt?
Good morning. Thank you, Don. And good morning, Brevard County. Thank you for tuning in with us on this year-end Facebook wrap-up opportunity that we have here today. It is extremely important that we have these type of events and get this information out to our citizens across the county. County government really has two main tenets of things that we do to serve you as our citizens. And one is to provide core government services, which we've touched on with Mr. Golden and all the other great services that we provide in Brevard County. The second is to provide information to our citizens so they can make the best decision for themselves, their families, and their loved ones. So I hope all the things you've heard this morning, you're taking those into account as you make great decisions and good decisions for you and your family, not only through this upcoming holiday season, but also through the next upcoming year. We read the news, we all know that there is another variant. There's a potential train coming down the track, and we've been on this track before. So if you haven't been vaccinated or if you haven't received your booster, please consider doing that, because these things, as we've said earlier, they're somewhat preventable, and this is the greatest tool that we have in our toolbox is those vaccinations. So all the information that you get here today, I hope that's one of the things that resonates with you, that we see this coming. We've done this before, and we know the outcome if we don't do anything. If we are proactive and we attack this as a community, we can make a difference on the back end of this. I've mentioned holiday season coming up too. On behalf of the fire chief, I'd be remiss if I didn't at least touch on a little bit of holiday season safety. If you have Christmas trees and they're alive, please make sure you continue to water them. Those are a tremendous fire hazard. If you see your Christmas trees obviously getting dried out, please consider taking the decorations off, remove them from your house, removing that fire source, and getting those out to the curb for disposal. Also, as we go through the New Year's weekend, please have a very safe and happy New Year's. As John said, it's been a long year. The holiday season is coming up. We need to be with family, with those that we love. Celebrate, have a little bit of fun, but be safe as you do those things. Be mindful of what is out there, and from a safety standpoint as well from the COVID. Make sure social distancing, and please consider on those vaccinations. It's been a great year, 2021. I hope 2022 will be just as fun and interesting. And as things happen, we will make sure that we're getting back in touch with you, the citizens of our county, to give you the information that you need, that you can make great decisions. With that, again, thank you for tuning in with us this year. And Don, I'll pass it back to you.
All right. Thank you, Matt. So as we normally do at the end of these programs, we will turn it over to Jesse Ray, who has been monitoring Facebook Live for your questions, and she will hopefully pose those questions to the appropriate person that can answer them. So Jesse?
I will certainly do my best. Thanks, Don. Okay, so we have some from the media that we usually get. So we'll start with those. Have there been any cases of Omicron detected in Brevard County yet? I don't know if we want to do that with DOH or John Scott.
Yeah, I'll answer that. So, yeah, as of the reporting yesterday, no. Again, it takes a few days to get those back. The state labs do a percentage of specimens to look for the variants, and then you extrapolate from there. So I fully expect that we will be getting those. And again, as you look at the media report from Orange County, with it being detected in the wastewater, I mean, we know it's here, so it's coming.
Okay, thank you.
Jesse, can I just add to that, just so that everybody fully understands, and we've mentioned this in the past with other variants, the vast majority of our testing done right now is the rapid testing. The rapid testing is going to test a positive or a negative. It's not going to test the variants. So not all samples are tested for variants. So because we've not had a positive Omicron does not mean that it's not here. And I'm pretty sure it probably is here based on other things that we're seeing.
Okay.
One of the things that's really alarming is just a couple of weeks ago, this was only, they'd only had cases in a couple states. And yesterday I was hearing reports it's in 36 states. So the spread is pretty rapid, and they've said that all along. So
yeah.
Go ahead, Jesse.
So the predictions from the CDC are now for the COVID death toll to get as high as 845,000 deaths by the end of January. Do we think Brevard County will see an increase in deaths as well?
Well, obviously, we pray that we don't. It's hard to say. I mean, I think with the Omicron as that takes over as predicted, we'll have to see what kind of illness level people experience with that. Again, so far the early reports are that it's a more mild infection. Again, we'll have to see. You know, we're dealing with folks that you have a percentage of folks that have quite a few comorbidities, and elderly folks and folks that are immune compromised that we're worried about. So again, the best way as a community to mitigate that is to get yourself vaccinated, follow those measures that we know work, and again, protect those around you.
Okay, thank you. Skip over to, with the announcement from the CDC yesterday, will Brevard County vaccination sites continue offering the Johnson & Johnson vaccine, or will there be changes in advisement for those who are getting vaccinated?
I can take that one, Jesse. As of right now, we still do have the Johnson & Johnson. And the sites still have the Johnson & Johnson, and we will truly follow the recommendations of Florida Department of Health as well as the CDC. So as long as it's available, I'm pretty sure we will still be giving it. If it's recommended to stop, then we will stop.
Okay. Have you seen much of an impact so far in the new case data from the Thanksgiving weekend get-togethers, and what are your recommendations for Christmas and New Year celebrations? I know we kind of went over this.
Yes. So again, we have, as I said earlier, experienced a slight increase, a very slight increase. Again, as a recap, the week before Thanksgiving, at that point, I believe we were at 37 cases per 100,000, which is about as low as we've been since the beginning, really. Right now, we're at, as of the end of last week, 50 cases per 100,000. So there has been a slight climb. It's not dramatic, but it is going up. So moving forward into the holidays, of course, those recommendations would be what they were last holiday season. It's the same thing. It's masking in public indoor settings, avoiding crowded areas. When you're with family and loved ones, you know, again, encourage vaccination, use hand hygiene. If folks are feeling ill, as John pointed out earlier, don't go to work, don't go to the holiday gathering if you have those COVID-like symptoms. You know, a lot of it's common sense, and we keep saying it, but we keep saying it is because these are the tools we know that work, and that's all we've got.
Gotcha. Okay. What trends are you seeing in the recent vaccinations administered? So is it mostly the fully vaccinated people who are getting booster shots? Are we seeing more of the 5 to 11-year-old age group, or are we seeing more people getting their initial vaccines kind of this late in the game? And if that's the case, then what age groups are we looking at that are getting the vaccines?
So by far, it's essentially the folks getting their boosters. That's
Okay.
the vast majority of what we're seeing right now. Again, we're at about 11% of our 5 to 11 age group. They're about 11% of that population is vaccinated at this point. And when I say vaccinated, that's meaning they've initiated the series. So you have a smaller percentage of that have actually finished up with the second shot at this point. So, you know, we were honestly hoping that number would be a lot higher, that we would have had a bigger rush to get the vaccine for that age group. But you know, in terms of new vaccination, it's slow. I mean, we are getting people in, but low numbers.
Okay. So are we doing anything to ensure that we have enough medical staff to treat hospitalizations if Omicron creates another surge?
I'll take that one, Jesse.
Sure.
Again, we work with our healthcare partners. Staffing in lots of industries continues to be an issue, and healthcare is no different. But we stay, and the we in this is the county and the health department, stay in close contact with our hospitals, with our primary healthcare community, and to do all we can to alleviate any obstacles. Right now, we haven't heard any issues. Again, staffing is an issue for everybody.
Understandable. Thanks, John. Are we seeing a higher percentage of the vaccinated or the unvaccinated patients who are dying from COVID?
Over time, it certainly is the unvaccinated. Again, you know, there's folks that that do pass that are vaccinated, typically with a variety of comorbidities, and typically with that, the very elderly. So that does happen, but yeah, the vast majority are unvaccinated.
Okay. Okay, here we go. Do the Regeneron antibodies work against the Omicron variant?
I don't think there's enough data out on that yet. We'll have to see. I mean, again, with vaccines and whatnot, people are getting the variant. I mean, it's not 100% protection against becoming infected. The bigger picture is preventing hospitalizations and death, which the vaccines and the monoclonal antibody treatment have been a tremendous tool in helping to prevent that high hospitalization, and certainly the death rate would be much more higher, unbearably high, if we didn't have those tools in place.
Okay. And I'm sorry, I'm going to kind of butcher this word. I haven't seen this word before. Are we working to secure the sotrovimab antibodies like we have the Regeneron?
I'm not sure about procurement.
I'll take that one. So the folks who actually operate our site are CDR Health. They're a vendor or a healthcare vendor who do that. That would be more of a thing for them. I know that in general, as things get tested and approved, and if they're proven to be a viable and valuable resource for people, as John talked about, a helpful tool, that'll be a thing they work towards. But I'm unaware if that's a thing that's happening right now yet.
Okay. So people who have had COVID in the last year, do they need to get vaccinated? Or do they have the antibodies and they don't need to worry about getting vaccinated?
The CDC recommendation is that those folks get vaccinated. Again, everybody's immune system's different. So yes, folks initially have some natural immunity. We know that as fact. So you do have some protection there. What a lot of the studies are showing is that those folks that have been infected and have natural immunity and then get vaccinated are tremendously protected moving forward from reinfection. So absolutely, if somebody's had the disease, absolutely get the full vaccination.
Okay. Is there still a dashboard that's available for people to visit to be able to see, the amount of deaths, the amount of COVID, those kind of things? Are we still able to see that? And if so, where can they find that information?
The Florida Department of Health is putting out a dashboard that reports the weekly data, not the daily data. There is also data available through the CDC. The state does report to CDC, and there is data available on the CDC. So the dashboard is a little different than it was in the beginning, but the data is still available. I do not have the CDC website right in front of me right now, but
They could probably Google it.
yeah, and we did have it up on one of our last
I
Facebook
I
Lives.
believe it's data.cdc.gov.
Okay. All right. So for people who are asking about percentage of deaths and those kind of things, they can probably find that information.
Yes, the deaths would be reported there.
Okay. Excellent. Testing. Are we seeing the same amount of testing like we have in the past, or has that dropped a lot as far as people who are getting tested for COVID?
It had dropped when we were seeing our lower case rates, but as of late, the last 2 weeks, I believe that the testing has picked up a bit.
Okay. And I have one last thing. Ian, somebody was a little bit concerned that your face was very red because you were wearing your mask and you couldn't breathe. We just wanted to check on you. Are you okay? Can you breathe?
Yes, I can breathe fine. Thank you. Anybody who watches me in the box during regular board meetings knows my face turned red. I will just say that the reason I continue to wear my mask is, even though I'm fully vaccinated, boosted, is I don't want to be the person who brings it back into my house, because you can still transmit. So
Totally
thank you.
understandable.
I appreciate the concern.
Right. They were just concerned. So I just want to check on you. All right, Don, that's all I've got for today. I appreciate it.
All right. Thank you, Jesse. All right. Well, that will conclude our update for 2021. Hopefully you won't hear from us again for a long time, but as these numbers rise and as the concerns in the community regenerate or whatever, we will certainly want to keep our residents updated. So it will be highly likely that we will be doing these in the weeks ahead. And on that note, I will wish everybody a happy holiday. Please stay safe. Please heed the advice that you received today from our health officials, and keep yourself and your family safe. Thank you.